when a 1 or 2-year-old comes into the dental office, what are they doing?
And that's a really good point, because I think a lot of parents don't make that appointment because they don't think their child's going to do well, and then their next thought is, well, they're not going to be able to do anything. So what's the point? And I'm sure you do the same thing in your practice for patients of every age. You cater the appointment to the individual child. And so you start slow by introducing them to our little stuffed animals with teeth. Let them brush, let them use a mirror, and familiarize them with some of the dental tools that we would use on them. We start with what's called a toothbrush prophy, where a toothbrush is familiar to them, and we'll start by just brushing with a toothbrush. And a lot of times while you're in there brushing, you can do an exam and see if anything's going on, because you're already in the mouth. Some children surprise their parents, me, everybody, and they'll hop up in the chair and let us do everything. But more often than not, that's not the standard.
You pretty much just want to bring your kid in to let them know that the dentist is not a scary place.
Yes.
The bottom line is that even if we can't do anything for your kid, your insurance is probably covering this appointment anyways, and you have the benefits, and you should just bring your kid in, let them get familiar. A lot of people have a lot of scary thoughts around the dentist, and they just are afraid. And if your child's first visit is when they have 5 or 6 cavities and we have to do all this stuff, they're going to have a completely different perspective of the dental office. Whereas if you bring them in earlier, they ride the chair, everybody's nice, there's stuffed animals, all this kind of stuff, you're going to change sort of the way that your kid's mindset is.